In today's video, I'll be discussing about sexually transmitted infections known as STIs. There are a lot of these infections, but I'll be focusing on the 8 most common ones. And if this is your first time of watching my video, my name is Cherichi, a fertility nurse and a staff nurse midwife. And my channel focuses on women's reproductive health and fertility. And if this is the kind of content you like watching, please subscribe to my channel. So what is these sexually transmitted infections? They are infections transmitted through sexual contacts caused by bacteria, viruses, or parasites. Although some can be transmitted through other forms of exposure like blood transfusion and kissing when there is sore around your oral cavity. That is wound, when you have wound around your oral cavity. It can also create a means of transmission. I'll be discussing these infections based on 2 broad classifications, the curable and the incurable ones. In the sense that some are curable while some are incurable. But those ones that are incurable are treatable, meaning that they can be managed with some drugs which will help to minimize the negative effects they will have on one's health. And the curable ones are usually caused by bacteria or parasites, while the incurable ones are caused by viruses. So let's start with the curable ones. We have 4 curable ones. Remember, I told you that we have a lot of them, but I'll be focusing on 8. That is 4 curable and 4 incurable. So we are starting with the 4 curable ones. Number 1 is syphilis, gonorrhea, chlamydia, and trichomoniasis. Let's start with syphilis. Syphilis is caused by a bacteria known as Treponema pallidum, and it's a very serious sexually transmitted infection and can be spread through the vagina, oral or anal sex. It causes sore on your genitals. If left untreated, it can lead to serious or permanent problem like brain damage, paralysis, and blindness. Even infected mothers can pass this to their baby in pregnancy and childbirth. It is the second leading cause of stillbirth globally and can result in other adverse birth outcomes such as neonatal deaths, congenital deformities, low birth weight, and prematurity. One thing about this syphilis is that many people don't show symptoms of this and they don't even know that they are infected unless when they go for screening, they will not find out that they have this infection. It is treatable and is curable since it's caused by bacteria, and antibiotics is the best drug for the treatment. The next one is gonorrhea, also caused by a bacteria called gonorrhea. It is treatable and curable, but it may be on the verge of becoming an untreatable disease because it is developing resistance to one of the drugs used in this treatment. And those that are diagnosed with gonorrhea are at risk of developing serious complications, and if left untreated, can lead to inflammation of the womb in women and infertility both in men and female. This infection can even be passed from the pregnant mother to the baby. It can lead to early labor or delivery or permanent blindness in a newborn. So you need to be careful with all these sexually transmitted infection. Always play safe, please. The next one is trichomoniasis, which is caused by a parasite called Trichomonas vaginalis. It is the most common of the curable STIs. One thing about this parasite is that it is very tricky. When we are wearing a condom, the areas that are not covered very well, the parasite will infect that area. So condom does not give full protection of this infection. This trichomoniasis can increase your risk of getting or spreading other sexually transmitted infections like HIV. Pregnant women with this infection are likely to have premature babies with low birth weight. Then the last but not the least of the curable STIs is chlamydia, also caused by a bacteria called Chlamydia trachomatis. It's one of the most common STIs in women, especially young women. And one of the symptoms is painful urination, but most often there is no symptom. It can affect the genital tract, urinary tract, and the eyes. If left untreated, it can lead to blindness, infertility, PID, known as pelvic inflammatory disease, and ectopic pregnancy. It can also put the head of an infant born by an infected mother at high risk. The best drug for the treatment of this infection is antibiotics. But you need to be careful in this treatment because this infection can reoccur. Then let's move to the incurable ones. Remember I told you that they are majorly caused by virus. They are incurable. So number one is herpes simplex virus, HSV. And this HSV comes in two forms, the form 1 and form 2. Form 1 causes oral herpes, that is around the mouth, while the form 2 is associated with genital herpes, that is within the genitals. And these two forms are notable for the formation of sores and blisters in the affected areas. That is, anywhere you see them, you will notice them by the formation of sores and blisters around that area. These sores are highly contagious and they can be transmitted via skin to skin contact. So this is all for the HSV, herpes simplex virus. The next one is hepatitis B, HBV. This can be a serious infection, although at the early stage, the symptoms are not really that kind serious and noticeable. But if left untreated, can cause liver disease and it increases the risk of liver cancer, liver failure, and liver cirrhosis. And one good thing about this hepatitis B is that it has this vaccine. This vaccine can be used to prevent this hepatitis B. So get vaccinated to prevent this hepatitis B. Then we have HIV, that is human immunodeficiency virus. What this virus will do just to harm your immune system over time. But when it progresses to S, acquired immunodeficiency syndrome, it will totally destroy your immune system to the extent that even the basic infections that on a norm your system will fight, they can no longer fight it because your immune system is totally down. It can no longer fight it. Once you have this HIV, you can even stay for years without presenting any symptom. But even within that period that you're not presenting any symptom, you can as well transmit the infection to another person. But one good news is that there's a medication that will block HIV replication so that it doesn't progress to AIDS. Because once it progresses to AIDS, there's no two ways about it. There's nothing else you can do. But once it's at the stage of HIV, that is human immunodeficiency virus, those drugs can still maintain you without showing any symptoms at all. But once it progresses to AIDS, all the symptoms will manifest. Remember, they are not curable. The drugs are just used to manage them so that the negative effects will not tell on your health. The last but not the least of the incurable STIs is human papilloma virus, known as HPV. It is considered as the most common sexually transmitted infection, and the types of HPV are classified either low risk or high risk HPV. When it comes to the low risk HPV infections, they are associated with warts affecting the genital regions, oral regions, and the anal regions, and they are relatively harmless. On the other hand, the high risk types HPV are linked with a significant increased risk of certain types of cancer, like the cervical cancer. Unfortunately, there is a vaccine that you can take to prevent this HPV in the future. So get vaccinated to prevent these infections in the future. So coming to the high risk type that is associated with some certain types of cancers like cervical cancer, there is a particular screening that is recommended for it, which is called pap smear. This pap smear is being done to test for the precancerous or cancerous cells within the cervix. And how often you need this pap smear is determined by various factors like your age and risk. Once you are less than 21 years, you don't need this pap smear. Then between 21 to 29 years, at least once in every 3 years. Like, let's say this age 2024. Once you do it this 2024, 2025, 2026, 2027, you now repeat it once every 3 years. Then between 30 to 65, once every 5 years. Then from 65 years and above, you don't necessarily need this, but always meet with your doctor to explain your health for your doctor so that they can determine what to do for you. In summary, preventing STIs starts with practicing safe sex. Once you practice safe sex, you are one step ahead in preventing sexually transmitted infections. And it's always advisable to go for infectious screening at least twice in a year, except the pap smear, to be on the safer side, because any diagnosis comes with a better prognosis. Although some of them are incurable, but once you detect them from the early stage, you can be managing them. And one thing about this infection is that you don't treat them by yourself. You cannot say, let me go and buy drugs and start treating myself. No, you must meet a doctor, because these infections are very contagious and they are killer infections if left untreated. So maintain this wellness behavior, constant checking of yourself to detect them early and manage them properly. So if you really find this video informative, subscribe to my channel, hit the like button and the notification bell for more health tips. Have a nice day.